I was on mute. Good afternoon, everyone. It's 2:00. Thanks for joining us. On today's panel, we have Milwaukee Mayor Tom Barrett, Dr. Ben Weston, Associate Professor at the Medical College of Wisconsin and Director of Medical Services for the Milwaukee County Office of Emergency Management, Darren Rausch, Health Officer and Director of the Greenfield Health Department, and Kirsten Johnson, Commissioner of the Milwaukee Health Department. Mayor Barrett, you're up first.
Well, thank you very much, Sydney. And I'd like to begin by talking about several news items that have been in the news cycle for the last couple of days. The first one is the situation in India, where we saw just in the last 24 hours that India now has the highest one-day total of COVID-19 positivity of any country in the world. Although the rate, given the population of India, is actually lower than it was here in the United States when we had our peak day in the last several months. But it jumped out at me that it tells you just how serious this issue remains as a worldwide issue. The second series of articles that I looked at was a conversation about rich countries and poor countries. How with numbers growing in some of the poorer countries in the world, the challenge they have is not only rising numbers, but the fact that in many of those countries, there are no vaccinations whatsoever. So here we are in the United States, here we are in Wisconsin, here we are in Milwaukee, and we are blessed. We are truly blessed to have these vaccines. And I'm sure that around the globe, there are ethical and racial and justice arguments that are going on about why some countries, some of the wealthier countries have the vaccines and some of the poorer countries don't have them. The reason I mention this is here we are in Milwaukee, and over the last week or so, just like nationally, we have seen the number of people who are getting vaccinated actually going down in terms of the rates of people getting vaccinated. And late last week, I was talking about how at the Wisconsin Center, for example, our daily capacity is 4,000, yet we are only doing about 2,000 vaccinations. And I know that there's a lot of political conversation. I know there's distrust of vaccines. I know that there are other dynamics at play here. But I think it's important to just pause and think, well, wait a minute. Part of the global argument is that some people have access to it and others don't. Here we have access to it. Everyone in this community right now has access to the vaccination. And our request has been to get vaccinated. So I'd say the good news or the promising news, I can't call it good news yet because the number's not high enough. Our vaccination rate for Milwaukee adults who have completed their vaccine series is now 25.7%. So we've gotten over the 25% number. We want that to go higher, obviously, but at least we're starting to make progress and we're over 25%. So that's the good news. We want to continue to see this number rise. In addition to the Wisconsin Center and our community vaccination sites at the Northwest and Southside Health Centers that were stood up at the beginning of this week, we are really working hard to bring the vaccine to additional locations in the community. And we're taking a number of different approaches. At this very hour, our health department is working with the Brewers to vaccinate seasonal staff, the people who are working at the stadium. Obviously, they've already dealt with the players and a lot of the professional staff, but we want to make sure that the seasonal staff has an opportunity to be vaccinated as well. Tomorrow morning, we will have vaccinations available at the Lake Express Ferry Bicycle Trade-In event located at 2330 South Lincoln Memorial. Give a gently used bike and get a Lake Express ticket. And if you want, get a COVID vaccination. It's almost like TV Lenny, get a bike, get a shot, get a ride. Lots of opportunities there. Saturday, we will be back at the Wisconsin Black Historical Society located at 2620 West Center Street from noon to 4 p.m. Again, trying to get into the community and convince people that it's a good thing to get a shot. There are many more scheduled vaccination clinics at churches, businesses, and community gatherings coming up soon. And if you're interested, and if you can get us 50, 60, 70 arms, give us a call. We'll work because we are working to reduce barriers and make it easy for everyone in Milwaukee to get vaccinated. Since it's Thursday, I would like to provide an update on this week's gating metrics. And I'm sure Darren and Dr. Weston probably will be touching on some of these things as well. And I think Kirsten might be on the call too, but we remain, unfortunately, in the high transmission category for the number of COVID-19 cases per 100,000, just as we were last week. And our percent positive for cases remains in moderate transmission category. This is not where we want to see our numbers. We cannot carry out our vaccination efforts and then disregard other safety measures that protect us from this virus. Tools like testing and everyday measures like continuing to wear a mask, wash your hands, and watch your distance remain important mitigation efforts against COVID-19, because again, we've seen these numbers rise in the past month, and that is of concern to all of us. I'd like to end my remarks by reminding everyone that today is Earth Day. Earth Day began in Wisconsin over 50 years ago. Senator Gaylord Nelson was the father of Earth Day, and thanks to our great community partnerships and environmental leaders, Milwaukee has made great strides in healing our environment. I cannot thank our local organizations and city departments enough for their work to create a greener, more resilient Milwaukee for everyone. This includes investments in solar energy, green infrastructure, stormwater management, and improvements to our waterways, among many, many others. If you're looking for a safe way to take part in Earth Day this month, consider getting involved in an outdoor cleanup event, the parks, the river, the boulevards. There's lots of opportunities because fortunately Earth Day falls once spring begins and we start seeing what I call the lasagna effect of having snow, garbage, snow, garbage, snow, garbage. And we all can play a part in cleaning that up. You can mask up and remain physically distanced from others while helping to clean up our parks, our neighborhoods, and our lakefront. So again, see what you can do, or pick a river. Pick a river. We got 3 of them. Pick any river. And let's do what we can to make this an even greater city. So with that, I believe I turned over to Dr. Weston, if I'm not mistaken. Dr. Weston.
All right. Thank you, Mr. Mayor. Good afternoon. First, to our numbers. We are currently seeing an average of 140 new cases a day and about 2 deaths every 3 days. As mentioned, we continue to see a concerning decline in daily vaccinations in Milwaukee County, down another 1,000 vaccinations a day to about 6,600 people being vaccinated on average in the last week per day. Now, we did add to our key indicators as well on our dashboard, one that will be critical to our community, and that is for vaccine. And we're looking at 2 trends when we consider how we're doing as a community on vaccination. So we look at both the total percent of people in our county who are vaccinated, as well as the vaccination rate in our 2 most vulnerable groups. And that's the CDC-defined high and moderate high vulnerability groups. So this helps to ensure that the vaccination effort is done in an equitable manner. Equity is key to our vaccination efforts and our ability to move forward as a community. Currently, the total population is at about 36% vaccinated or receiving 1 dose of vaccine, and the 2 highest vulnerability groups are at 27%, having received at least 1 dose of vaccine. And by these metrics, we currently remain red. Once they both exceed 50%, we would move into the yellow territory. And we'll continue to track this metric as a county moving forward. Also on the vaccine front, as we pass 200 million doses of vaccine being administered in the United States, we continue to see more and more encouraging research on the effectiveness and safety of the vaccines. When the vaccines were studied in the trials in the fall with tens of thousands of people, they were found to be highly efficacious, providing anywhere from 74% of people for Johnson & Johnson to 94 and 95% protection for Moderna and Pfizer. However, now that they've been given to a much larger population, millions and millions of people, they're performing even better. Of the more than 75 million people who've been fully vaccinated in the United States, the CDC found that less than 1%, in fact, way less than 1%, have reported becoming infected with COVID. And another study out of the New England Journal of Medicine recently found that the same less than 1% breakthrough infection rate when studying hundreds of vaccinated people. Now, on top of that, also published in the New England Journal of Medicine was encouraging news for pregnant women considering vaccination. They found thousands of pregnant women who have received either the Moderna or the Pfizer vaccine, and they followed them to understand any effects on the safety of pregnancy. And after reviewing the data on these women, they found no difference in pregnancy outcomes in those who had received the vaccine compared to the general population. Now, that's in contrast to the very real and the very well-known and very well-studied danger of getting COVID infection while pregnant. Pregnant women who are infected with COVID are more likely than others to have a severe illness. They're more likely to need to be in an intensive care unit, more likely to need to be on a ventilator, and more likely to ultimately die from the disease. So the decision on whether to get vaccinated in pregnancy is certainly one to discuss with your physician, but this data is further evidence of the safety of the COVID vaccine in pregnancy. And this double good news on the vaccination comes as it is easier than ever to get a vaccine in Milwaukee County. Same-day appointments are available across the county, and walk-in without appointments are happening at the Wisconsin Center, at Kosciuszko Community Center, the Northwest and Southside Health Centers, and the South Shore Public Health Vaccine Clinic. In addition, this weekend, there are pop-up events all over the county, from the Muslim Community Health Center, the Wisconsin Black Historical Society, Unity Gospel Church, Brentwood Church, Holy Redeemer, Presbyterian Church, G's Clippers. There's so many events going on all over the county just this weekend alone. And you can log in to healthymke.com, click on the COVID vaccine locations, the orange button in the upper right. You can see all the locations and all the times for vaccine near you. The vaccine is our pathway back to normalcy. So let's take time to learn, to talk to those you know who've been vaccinated and hear about their experiences, and to seek out a location and a time that works for you. Thank you and stay safe, and I'll hand it to Director Roush.
Good afternoon, and thank you, Dr. Weston. It's my pleasure to join today to talk about some of the data and dig into the data related to COVID-19 cases in our community. Let me start today by talking about a few overarching comments just to set the tone for what I'll talk to you about momentarily. We are continuing, unfortunately, to see sustained increases and slight increases in cases throughout the county. While this is seen both in the suburbs and in the city, the case increase is more pronounced in the city of Milwaukee for both the whole population and for children. And this news not only underscores the need to continue mitigation strategies, but also to continue seeking vaccination and getting vaccination wherever you can, as the previous speakers have mentioned. So let me go ahead and pull up the data and we'll take a look at what we're seeing for this week. So the graph in front of you here is looking at new cases of COVID disease, and really what the story that we've been monitoring for several weeks now, really starting about the first week of March, is a steady and sustained increase in cases for both the suburban communities in blue and the city of Milwaukee in the orange line. And we're seeing this not only in the adults, but we're also seeing this in the school children. So the graph on the screen right now is looking at school-age children 18 and below, and we see a very similar trend, a pretty flat plateau through the early part of March and a steady increase in both the suburban communities and the city of Milwaukee. Going back to the full report, as Dr. Weston has reported, and we've mentioned for several weeks, deaths are down in our community, and that's largely related to very high vaccination rates for our most vulnerable individuals over the age of 65. We've talked about the transmission rate for many weeks, and again, unfortunately, this week I need to hearken back to the fact that we need to continue to do the things to keep ourselves safe, to think about social distancing, wearing masks, etc., because our transmission rate is above 1 and has been above 1 really since the beginning of March, since the start of that increase, both throughout Milwaukee County, in the suburbs, and in the city of Milwaukee. So while this graph shows the increase and the largely sustaining of our transmission rate above 1 for the entire county, down below, I can reflect and show data for the city of Milwaukee on the top, with an increase in the more recent days, and the suburban communities with a more flat pattern. So this is something that we certainly want to monitor very closely. We've known for a few weeks that cases have been increasing, and we've talked about how the demographics have been problematic in the past. You know, we've tracked cases by age group, we've tracked cases by race, ethnicity, by household income, and we've seen increases across all of these groups. But what I want to target today and focus in on is it looks like the rate of change has increased in the Black or African American community and might be contributing to some of the increases. And there's further data to support that. It's hard to say exactly specifically what's happening in that community, but that particular race and ethnicity subgroup seems to be growing at a higher rate here. You can see more of an increased change than any of the other race and ethnicity groups. We also see that when we look at the population adjusted incidence rates of new disease as well. We see the Black and African American line trending very closely to the white line. So you see that the red line is kind of obscured by the blue line, but you see a little bit of an inflection here over the most recent days and weeks. And that's going to be something that we want to monitor very closely. The rate in the Black or African American population is now 92 per 1,000 residents, surpassing the white rate of 90 per 1,000 residents. And again, before I leave this slide, I want to really point out that our Hispanic community, our Asian community, and our American Indian and Alaskan Native populations are even higher, further demonstrating that disparity that we've seen for a long time. Hospitalization data is showing similar changes in trajectory for that Black and African American subpopulation, and we can see that here in this graph as well. And again, this just further provides data and information to target our interventions, target our mitigation strategies, and target our vaccination efforts into communities that may still disproportionately be impacted by COVID disease. I want to talk next about testing, and we certainly know that there's a lot of testing capacity. It's very exciting to see that testing was actually increased last week over the last several weeks. Testing is available readily throughout the county, and I encourage anybody who has symptoms or anybody who wants to know their disease status to seek testing. In a positive note, as it relates to COVID data, we actually see a little bit of a downward trend as it relates to the 14-day percent positivity trend at the moment, with some of this data still pending. But that is a positive sign because it's not a trend that we've seen recently. Lastly, I want to highlight some of the spatial patterns, and the spatial patterns that I'll highlight will underscore some of the increased disease that we've seen and that I talked about moments ago. So this particular map is looking at cases of COVID-19 throughout the 14 months of the pandemic. And we can see that the areas in red and orange is where we've had a high preponderance of disease cases. When we look more specifically at the last 2 weeks, we get a glimpse of areas in the county that have shown high levels of disease recently. And so the areas in red and orange, again, are the high points and the highlights where disease is still occurring rapidly. And we see some of the changes from week to week when we look at these maps. So last week, this map looked entirely differently, but this week there's a large focus of activity and focus of disease activity in the north and west side of Milwaukee up into Brown Deer. And we also see some similar activity throughout the western part of Milwaukee and some of those southwestern suburbs of Greenfield, Greendale, and Franklin. So these are areas that we want to be paying specific attention to because disease activity is still occurring at a high level. Next, I want to talk about another spatial map looking at hospitalizations and a similar trend that we can see that highlights what's happening in our community. So here is cases hospitalized throughout the county throughout the duration of the pandemic. And again, red is the areas where people have been hospitalized at a greater percent and at increased levels. When we hone in a little bit more recently, actually I take that back, this is just looking at the last 13 months. So we don't have a 2 week, but certainly we can see that there's been a lot of hospitalizations in some of those communities that currently now have high rates of disease. So ending the data and just providing some summary remarks, we still have disease in our community. The disease has been increasing for the past 5 weeks. And although the rate has been increasing slowly, it is higher than we have been in the period of February and March when we were at our lowest point. We continue to see increasing cases throughout the population and in our kids, and this has deleterious impacts on isolation and quarantine needs in schools and in other settings. We need to continue to do all the mitigation steps available to us. The 3 W's, wearing your mask, watching your distance, and washing your hands. And as Dr. Weston and others have mentioned today, there are a lot of vaccination efforts and a lot of vaccine availability throughout Milwaukee County. And generally, many of those are walk-ins. So any barrier that exists with scheduling an appointment is now removed. For so many weeks, I said eligibility does not equal availability. But certainly for the last few weeks, we know that there is significant vaccine in our community, and we just need to encourage anybody who needs to get vaccinated to seek out a vaccine so that we can suppress COVID-19 in our community. Thank you all for your time and attention, and I'll now turn the briefing over to Kirsten Johnson from the Milwaukee Health Department. Kirsten?
Thanks, Darren. Good afternoon. Tentatively, the Milwaukee Health Department and FEMA will be closing the Wisconsin Center on Friday, May 28th. This is 5 weeks away and as planned. On average, we're administering 350 first doses a day at the Wisconsin Center. And to Darren's point, we have capacity for 2,000 first doses per day at the Wisconsin Center as it stands. Northwest and Southside Health Centers, which is where we will pivot our Milwaukee Health Department resources, can administer 400 to 600 doses per day. And we are currently averaging less than 150 or 300 at each respectively. This change has no impact on state supply. We will no longer receive additional federal doses through FEMA, but there is ample state supply to meet our demand. The Milwaukee Health Department sites will continue to take anyone from Wisconsin who wants to be vaccinated. In addition, we'll continue and will increase our mobile and worksite vaccinations. And as Darren mentioned as well, there are many sites throughout the region and state with vaccine supply. So we're not concerned that this is really going to have an impact on people's ability to access vaccinations. Thank you.
Thank you, Commissioner Johnson. As a reminder, media, please place any questions you have for our panelists in the chat, and we'll read them off in the order that we receive them. Our first question comes from Hillary Mintz at WISN 12 for Commissioner Johnson. Can you talk about the Wisconsin Center closing at the end of May? Is this the right time or too soon? And was it a successful location?
It has absolutely been a successful location. I think the question is should we close it sooner, actually? And I don't think so. I think we still want to give people ample time to have access to vaccine. But there were weeks when we were doing 3,000 doses a day, and we are really down to doing the second doses of those. For example, if there were 1,500 first doses in a day, we're doing those 1,500 second doses and less than 500 first doses a day. And as Darren mentioned and others and Dr. Weston, there are many places in the city of Milwaukee where people can access vaccine. We want to make sure that people know. We wanted to give enough warning and time that the Wisconsin Center would be closing. But I'm confident that if someone wants a vaccine in the city, that they can get it.
Our next question is from Allison Durr at the Milwaukee Journal-Sentinel. The city had the Wisconsin Center set up as a mass vaccination site before it had any federal support. Why totally cease that operation?
And again, it's really about demand. It doesn't make sense for us to have a large site set up for a mass vaccination center that has the capacity for 4,000. And like I said, at one point we were doing close to 3,000 doses a day and only have 300 people. It's very resource intensive. And from the health department standpoint, we are very confident people have access to vaccine elsewhere.
Second part of the question from Allison Durr is, I'm assuming with FEMA leaving that in addition to vaccine, the city will also lose federal staff support. Is this the case? And if so, what is the health department's staffing plan? For example, will staff members who were moved off the vaccination efforts because of the federal support be reassigned from normal duties back to vaccine efforts?
So we actually still have Milwaukee Health Department staff at Wisconsin Center. So they're managing, they're doing some data entry, there's some people in reception. So we have a fair number of people from the Milwaukee Health Department staff who are still working at the Wisconsin Center. Those individuals will likely either go back to their role previously, or more likely will be re-put into the plan in terms of doing our mobile sites.
And I'd like to just add to Alice's question, if the demand is there, we will make sure that we have the ability to have vaccinations. But I think everyone understands if people aren't coming, those resources should go somewhere else. I much prefer them to be here. And if we see this line change and people start coming, getting vaccinations, we'll do everything we humanly can to make sure that we have them. But we're hard pressed to say, yes, continue to give us these resources if the demand isn't there. So that's why we keep beating the drum. Please get the shots, get the shots, get the shots.
Our next question is from Brittany Lewis at CBS 58. Do you believe the decreased demand at the Wisconsin Center has to do with reaching a wall in the number of people who want to get the vaccine, or is it because there are more locations to get the vaccine and more availability?
I think, and Dr. Weston can speak to this as well. I've heard him speak on it previously, but I think what's really occurred is the individuals who are eager to get the vaccine, they came again, we had days of 3,000 people getting vaccinated at the Wisconsin Center. We have vaccinated those people who they wanted to be first in line and they were ready to get it. I think we're now in this space where there are still people who want vaccine, but they're going to get it when it's convenient. They're going to get it if it comes to work. They're going to get it from their doctor at their annual appointment. That there's still people who want to have access, who still want the vaccine. They're just not going to be the first ones in line. So I think we're going to work through that. And then certainly we do have some folks who are more hesitant, and it's just going to take a little more time and education for them to become comfortable if they decided they wanted it all. And I also just want to speak to Mayor Barrett's point. Initially when we set up the FEMA site, we anticipated that we would be asking to extend, and we always knew it was going to be ending at the end of May or early June. So again, this is as planned, but because of demand, it doesn't make sense to use our resources this way.
Yeah, and I would agree. I don't see this as much as us hitting a wall, as much as moving to another phase. So the phase, just as Commissioner Johnson said, of people who are eager, but also people who have the means, people who are able to travel to a vaccine site, people who are able to have childcare to allow them to go, or able to take time off of work to allow them to go. I think we've reached the end of that phase of eagerness and ability, and now we're entering a new phase, and we're modifying our practices to meet that new phase. And so the Wisconsin Center may not be the best way to meet that new phase, but the mobile clinics that the Milwaukee Health Department and other health departments are standing up helps to meet that new phase that we're entering for vaccinations.
Our next question is from Hillary Mintz at WISN 12. What is the latest date someone can walk in to get their first dose at the Wisconsin Center?
May 28th. So anyone who comes in, and I'm sorry, I can't think of the date off the top of my head, but 3 weeks before May 28th and needs a second dose will be either an appointment will be made for them at one of our 2 sites, or they will be given a list of sites where they can potentially get their second dose. But our intention is to give people first doses all the way up until May 28th.
Our next question is from Mayanne Silver at WUWM. How does the duration of operation of the Wisconsin Center and the demand in Milwaukee compare to the demand at other large-scale sites around the country with federal support?
I'm assuming that it is very comparable. What we're seeing nationally is we're seeing a downturn in demand. And again, as Dr. Weston and Commissioner Johnson have said, it's because we've reached the second phase. But the federal government has been a very, very good partner. The state of Wisconsin has been a very, very good partner. So we don't have any complaints. We feel we've been treated fairly throughout all this.
Our next question is from Allison Durr at the Milwaukee Journal-Sentinel. How many weekly doses from the state does the city anticipate receiving once FEMA leaves? And why leave vaccinations at the 2 city sites open to people who live outside the city of Milwaukee? Will Northwest and Southside health centers remain walk-in locations?
So I would anticipate that we'll get 2,000 to 3,000 doses a day, which is what we were receiving prior to FEMA arriving and receiving the federal doses. I'm sure the state will give us whatever supply that we need. And in terms of Northwest and Southside health centers, yes, they will remain walk-in. And we are leaving it open because we want people to have access to vaccine any way they can, but recognizing with the locations we have, it's primarily going to be people from Milwaukee.
Our next question is from Sari Lusk at the Milwaukee Business Journal. What kind of uptake are you seeing from businesses and community organizations on the opportunity for you to come to them with a vaccine clinic? How much demand is there, and do businesses have to pay for that service? Also, what types of businesses and organizations are taking you up on this possibility?
So we are working with all different organizations and businesses. Today we're at the Brewers this afternoon. We're doing the Bucks tonight. So Bucks seasonal staff, and then we'll actually also be there during the game for anyone who's there who wants vaccine. Friday, tomorrow, we're going to be at the ferry. It's anyone who reaches out. I think we actually did a brewery. Anyone who reaches out to us and is interested in having a number of their staff be vaccinated, we would work with them. There is no charge. We're doing the Mexican consulate repeatedly. So it's anyone who has a portion of their staff, of their working population, that we can vaccinate.
That appears to be the final question in chat. Are there any other questions from the media? One question follow-up from Brittany Lewis at CBS 58. So you'll be giving shots to people who are attending the Bucks game?
Yes, today.
Last call for questions from the media. One more from Allison Durr. How do you follow up with people who would get a shot at the Bucks game?
So we give them a list of options for their second dose, knowing that we're going to be at the Wisconsin Center for 5 more weeks. They could come there to get their second dose. They could either register or walk in. And then, the same paperwork is filled out as we would at any other vaccine site. They fill out the paperwork. It's entered directly into the Wisconsin Immunization Registry. So we know who's been vaccinated, and they'll be, their second dose will either be scheduled or they can walk in.
And then I think you covered most of it, but Sari Lusk from the Business Journal is asking, what will that look like at the Pfizer Forum? When people come in, what does your vaccine situation or setup look like? Sure,
there's tables with people who are ready to vaccinate, and folks who are waiting there to help them register. And then as people walk through and are interested, we get them registered, and then they get the vaccine.
Are there any plans to do this at future Bucks games, or I would imagine Brewers games as well?
We are talking about it. There are plans in the works. I think, again, we're trying everything we can. So if there's great uptake, we certainly would do it again.
Any further questions from media? All right. Thanks everyone for joining us. We'll see you back here next week on Tuesday.
Thank you all.
Thank you.